Hello everyone, we've connected back for the session. Let's see if this time it is working fine. I'll just quickly get in Vidya and Dr. Deepa.
Okay, how is it now? Should I remove my headset? Is it because
No,
of my
no,
headset?
yours is the perfect voice. No, why are you removing the headset? Mine is not
Okay.
echoing now, I guess.
Mine
Hey, it's working, I think.
working.
No?
Okay, chalo, good.
Oh,
Yeah. All right.
okay. So, a
Yeah.
very quick introduction for whoever has joined us. Dr. Deepa is a pediatrician. Okay, she has more than 8 years of experience, guys. We will share her details in the video description below so that you will know what is her specialization. Now, to get started with the session, the first question is, what does meconium mean and how critical is it for the babies?
Yeah. Meconium is the first stool what the baby passes. It's usually blackish green and tar-like in consistency. Okay, and it's initially present for say up to 4 to 7 days initially, and we ideally recommend or we ask the parents to make sure that the baby passes it within the first 24 hours of life. Okay.
Okay,
So now I'm audible, right?
Yes.
perfectly.
Okay, good, good. All right.
Nilufer, you want to take up
Now,
the
moving
next question?
to the second question, you've already answered that, Dr. Deepa. So you said that baby needs to pass the meconium within the first 24
Yes.
hours of his or her life. So that was actually
Yes.
our second question.
Yeah.
You also answered the third question, that how long it should last, like basically
Okay.
how many days we can expect, tardy stools from the baby. So
Hmm.
you said that it can be a 4 to 7 days. Okay, so
Yes.
moving on to the fourth question. Does meconium indicate the health of the baby?
Yes, it definitely does indicate a mature baby, a baby who is come till term and the mother has delivered the baby, then they tend to pass the meconium at birth. Sometimes, if the baby is like post term, post dated babies, what we call, sometimes they pass the meconium in utero when it is in the baby's womb. Okay, so that and all indicates maturity in the baby. Also, usually early babies like preterm, what we call preemies, what we call, right? They are not supposed to pass meconium when in mother's womb. And if they pass, then we have to check for some specific infections in the mother that might have led to, early passage of meconium. And also meconium usually contains whatever the baby has swallowed or, throughout the pregnancy, right? That lanugo hair, amniotic fluid, then shed epithelial cells, and fats and lipids and whatever it is. So what kind of meconium it passes again definitely indicates the maturity of the baby. Yes.
Okay. Yeah. I'm just asking you a question, skipping from the ones we have. You said that there is a chance that babies can pass meconium while they are still in the mother's womb, preterm or
Yes.
postterm. Okay.
Yeah.
Now, is it a risk if the baby passes stools while in the womb of the mother, because then the baby is actually going to ingest that as
Yes.
well, right?
Exactly. Yeah. Yeah. There is a risk and there are some complications involved. If at all the baby passes meconium while mother is in labor, or while, she's before labor, sometimes the gynec might tell you or the gynecologist might tell you that the amniotic fluid is meconium stained. That means the baby is already past the meconium in the mother's womb. Now, how much of meconium is passed and the complication depends on that. Okay, it also depends on how mature the pregnancy is. All right, so if the baby is at term, they can immediately deliver the baby and they may decide the modes of delivery, whatever way it is. If it is a thin meconium, slightly meconium stained, then it doesn't cause much of a problem. But yeah, if it is a very thick meconium, the baby is literally covered in poop and almost swallowed everything, that might cause some lung related complications. So in that case, you should all have always a pediatrician on call at your delivery place, and make sure there are some steps to be followed while resuscitating the newborn who is completely covered in meconium. It's like that.
Okay. Thank you for that, Dr. Deepa.
Okay. Yeah.
So how will they know? So a simple scan will show the result, show this like
No,
meconium is reduced.
ideally, when they do the per vaginal examination, right? That time they tend to know the color of the amniotic fluid. Sometimes after there is a rupture of membranes and the delivery is due. Child mother is in labor and expecting a baby. That time they just swoop their fingers and then they check it for the stains, right? So amniotic fluid is usually clear urine like. There is nothing, no stain in that, but you have to correlate, just not the stained fluid. Other than that, baby's heart rate correlating to the mother's contraction, all that they correlate and then they decide on that.
Okay. Okay.
Just to give so that mothers are not there will be many pregnant women who will be watching this session now and
Yes.
later on. So I don't
Yes.
want them to be worried thinking that
Yeah.
has
Yes.
my baby passed meconium. So just a word to them that like if something is wrong with the baby, I think it's best if you address that, Dr. Deepa.
Yeah, see,
I
this
don't
is
want
not
you to be
something to be worried
worried.
for.
Yeah.
Yeah, so this is not something to be worried for or to expect that every baby is going to pass and every baby who passes meconium might go through this. Okay, it's all what happens during the labor and meconium. Since we have this topic, this complication came into picture. So just don't worry about it. The gynecologist, the pediatrician, the whole team will be with a good backup. There shouldn't be an issue or any complication. Okay.
Yeah. So, okay, thank you for that, Dr. Deepa.
Yes.
Yeah. Our next
Okay.
question is, what is colostrum and does it have an effect on meconium?
Okay, so first of all, colostrum, if I want to tell you, it's when we were learning pediat. Okay, so we were told it's a liquid gold. Okay, it's just a powerhouse of nutrients. Lots and lots of immunoglobulins and antigens and lipids, which is really really good for the baby. Okay, and colostrum is initially produced in the mother, initial milk that is produced. Okay, and it is supposed to say that colostrum helps in passage of meconium, so indirectly it has a relation like that.
Okay. Okay. So how early should the baby be given colostrum or the liquid gold?
Okay. So it should be given as early as possible. Okay. If it's a normal delivery, then ideally, I think within 30 minutes to 1 hour, the mother can feed the baby. And if it is an elective section or section due to cesarean section due to any other reason, I think within 4 hours of the delivery would be the ideal thing. But because of any reason, if the baby had to be shifted to an ICU or anything, then it depends. Whenever the doctor allows you to, then that time.
Okay. Just to let the viewers know, don't
Mm.
be alarmed or don't get scared of these words. These are technical words, but just
Please.
yes, just to me so that we get an idea, we are talking about those terms because now after COVID era, everything is on the internet. So when you hear about colostrum and meconium, you should not be scared. So that's the reason we are talking about it in this session.
Yeah, we
Mm.
just
And
had one
we have a
question
question.
from Norma Rafiq. So she's asking
Okay.
when should the mother feed the baby first time after the baby is born? Dr. Deepa has already answered it, but I'll just reiterate it.
Yes.
It's as soon as possible, as
Yeah.
soon as you can, as soon as the conditions allow you to feed the baby. That's the best. Yeah.
Yes. Yes.
Can a colostrum be donated? Can someone
Uh,
be?
See, if someone can express that much of colostrum, then yeah, you can donate it. But colostrum is usually very thick in consistency, and the amount that is secreted is also quite less. Okay, sometimes some mothers only are they are able to produce some 1 or 2 teaspoons in the whole 24 hours. So that time it will be a little difficult to deliver. But yeah, there are some things where we have heard the colostrum has been donated. If you can express, then you can donate it. Yeah.
Okay. There's one more question. What is high amniotic fluid index range? How can it be reduced?
Okay, I think for this, gynecologist would be the right person to answer, because this is usually measured in the sonography when they do the ultrasound, and they have some 4 quadrants of it. They measure over it and then they tell. So I think that would be answered by the gynecologist.
And it will be specific to each person as well.
Yes,
Yeah.
definitely. If low index, high index, it's specific for that particular pregnancy. Yeah.
Yeah, so the next
And
question is how much colostrum does the baby need? This is a very important question, Dr. Deepa, because there
Yes.
are hundreds and hundreds of women who have approached us on Instagram asking whether their milk is enough for the baby. They have so many doubts. Like the baby is crying, especially during the initial first, second, third day of the baby's life. Okay, because when people are trying to, when mothers try to express milk on the first day or the second day or the third day for whatsoever reason, they cannot express. You cannot expect to have 100 ml of milk or 200 ml of milk coming out. So what is the amount of colostrum that can be expected? Some general number wherein so that women are aware that this is all that can be made and that is all that your baby needs actually.
Okay. See, as I told, colostrum, since it is very thick in consistency, you hardly can express it, okay? And especially if the mother is trying to push it out or something like that without direct sucking of the baby, then it's very difficult to, express that. You will not get any flow. So she might feel that, she might feel very bad about herself that baby is crying and she's not able to feed her baby. So I would just tell everyone to just stay calm, let the baby suck on your breast, whatever drops, even few drops of it, if it is baby is able to get it like every once in 2 3 hours, that's okay. That's okay. Just keep giving. And nowadays, because sometimes the mother is not able to feed, or if the milk, if she feels she is not able to get so much milk, that time doctors do advise on formula feeding. So I would tell, okay, give formula feed. Along with that, whatever milk you are able to express, just give it to the baby. Okay,
Yeah.
because even 1 to 2 spoons, 1 to 2 teaspoons also, if you are able to give it to a baby, then it's like really good.
Yeah, and see, here we are talking in teaspoons and we are talking in terms of this because we just want to make you understand. But actually, when the baby is sucking, you cannot
Yeah.
really measure it.
No.
But it is
Nobody
okay.
can judge it. Nobody
Exactly.
can.
Exactly. So, I'm telling this out of my own experience. I think you need to trust yourself and your baby
Yes.
both. That is
Yes.
very important. Um,
Yes.
before, that's why, that's why every pregnant woman I ever meet, I tell her that, know about breastfeeding before, actually, you give birth to your baby. So, yeah, plan for that. And, if you are worried, I think it will negatively impact your.
Yes, definitely. Yeah. And initial few days, the mother will be having some restrictions in her oral intake, restriction in her liquid intake. That time you can't express a good flow to come out. And since this topic has come now, I would also advise mothers while they are pregnant, make sure you talk to your doctor about your nipple size, the position of the nipple, and all that. That also matters a lot in establishing a good feeding. If that is not there, then the baby doesn't latch, then it all brings you in a panic state,
okay.
right?
Yes.
How long does the colostrum milk keep coming, doctor? Like it's
Okay.
the first, only for the first feed or the first day?
Yeah. See, the milk in the mother, the any mammal as such, it goes in 3 phases. Okay. First is this colostrum. Then it lasts for like 3 to 4 days, maximum a week or so. Then comes the transitional milk. Transitional milk has some of the colostrum content and the routine milk, and then comes the mature milk. Okay, individually it depends upon every mother, individually it depends again on every pregnancy, and then it goes on like that. And once the mature milk is formed, then it continuously continues until the mother plans to breastfeed her baby.
Okay. Okay, there is a question here. Are all
Okay.
mothers able to start producing colostrum immediately after birth of child?
Okay. Sometimes minimal amount of milk is produced even in the third trimester of pregnancy. You can also feel some drops coming out of your nipple. Even that is fine. Yes, most of them do produce milk immediately after delivery. It's a natural process that happens because of hormonal this thing. So yes, it does happen, but it is not necessary that it comes out when you press it out. Okay, but production does start.
Okay, that was a very good
There's
point.
another
Yeah.
question. It is not related to our topic of discussion, but if you want to take it up, Dr.
No
Deepa,
issues. You
why,
can just tell me what it
yeah,
is.
why does my baby vomit after feeding?
Okay. So there are lots of causes why the baby vomits. Okay. Sometimes vomiting 4 to 5 times a day, curdle like vomiting, 1 to 2 teaspoons of vomit is quite fine. And if appropriately baby is gaining weight, then there is nothing to worry. But yeah, if the baby is not gaining weight and is persistently vomiting, large quantities of vomiting, and weight gain is an issue, then yeah, you will have to consult your doctor for this.
Okay.
Yeah,
There's
because
one
baby
more
needs to
question.
be examined, right?
Yes, baby needs to be checked because there are lots of things to be ruled out. And sometimes vomiting, see, sometimes even vomiting 10 times a day in the baby is fine if the baby is gaining good amount of weight. But for this, I would suggest personally to get yourself checked, get your baby checked with your pediatrician. Yeah.
Yes.
Yeah,
Yeah.
there's one more
Actually,
question actually.
yeah, please go ahead.
Yeah, I'm not sure, yeah, if Dr. Deepa is the right person. So how to know if there is dehydration or amniotic fluid is enough in the womb?
Oh, that will be again, yeah, answered by this thing.
Mm.
Okay,
And
there's another question. There are
mm,
so many questions. Actually, there are a lot of questions which we got from the story as well. Many were not related, but then yeah,
Okay.
I'll try to like sum them up like together. This question is from one of the person who's watching it. It's Mahi. My baby is sucking her thumb every time. Is this a serious matter?
No, this is not a serious matter for the baby, but for the mother if she is taking it seriously. Okay, it's a normal thing. Just avoid it, and baby will eventually leave it. The more you try to, remove the baby from that, the more she'll try to put it in. So just relax. Baby will leave it at one day. Okay.
Okay. Most of the things I do with my babies, I leave, it will
yeah,
eventually happen.
Yeah. Yes.
Yeah.
there's
Uh,
one more.
yes, Vidya, you are asking something?
No, there's one. I'm reading the questions only. How to give medicine to 3 months baby? B C O X B complex? Is it B complex? I don't know which
One
they are
second.
mentioning.
I'll have to see it.
I,
Where
I
is?
I cannot see that
Okay,
question.
how to give medicine to 3 month baby because my baby is vomiting.
Oh, okay. So baby is vomiting because of the medicine itself, or baby is vomiting because of some other cause. We don't know about it. So just if the see, usually whatever I personally do it for my kids. Whenever any medicine you are trying to give to your baby, please taste it once. Okay, if the taste is good, babies will eventually take it up, and if they are not taking it, then you just have to express your milk, 1 or 2 teaspoons, just mix it in the milk and give it, then it will be easy and palatable to the baby.
Yeah, that's a nice
Okay.
idea. Thank you for that, Dr. Deepa. There's one more question from the viewers.
Okay.
Why do babies want to have milk even after breastfeeding before 5 minutes? Always wants nipple in her mouth.
Okay. That is a sucking reflex, you know. They tend to have it, and they surprisingly, God's creation is so wonderful. This usually starts in the womb only. They are used to it. They just want something to suckle on. And breast, you'll not believe the breast, the smell of the mother's milk gives them a sense of security. So even if they want to sleep, they want it. Even if they get up, they want it. Even if they are, complete with their tummies full, they have had well, and still they want it. Yeah, she wants that nipple in the mouth. It'll be there for a while, and then eventually it'll come down.
That we
Yeah.
cannot do anything about it actually.
Yes.
Yeah, then another question. There are so many questions today. This session, I guess,
Yeah.
like, yeah, we did.
Yeah.
The viewers did not really go up because we had so many disconnections. But then the number
Yes.
of questions are like
Questions
Questions,
everything.
are.
they are coming up.
Yeah,
Yeah.
my
It's
baby is 45 years old and his stool is gray in color. He is taking formula
Taking.
and breast milk.
Okay. Yeah. Grayish color stool, greenish stool, change in consistency and color of the stool is normal because your milk contains some other protein and the formula milk contains some other kind of protein. So to digest it out, this color of poop is normal. Okay. But yeah, if there are, the baby is like passing this color of poop like 10 to 12 times a day or something like that, then you'll have to consult your doctor. Otherwise, once or twice a day, if the baby is passing, then it's good enough. No problem.
okay. There is
Okay.
one more.
Somebody is asking, is this a serious issue? I don't know what issue you're referring to.
Yeah.
So, yeah. Yeah, you're welcome,
Is
Swapna.
there is there any way? Oh, is there any way to find out?
I'm amazed actually.
Yeah. I actually lost. I lost the questions.
Yeah, even
I'm
I lost some
having one
questions.
question. So, is pumping absolutely necessary? Can we exclusively direct breastfeed?
Yes, you can definitely exclusively breastfeed the baby. As I earlier said, whenever you are pregnant, from that time, you make sure your nipples and the position of the nipples are fine enough so that the baby can easily latch. And if by any reason, if you are a working mom, you'll have to leave the baby and go, then definitely you can pump it up.
Yeah. Okay,
Okay.
somebody wants
There.
to know about pump. I'm so sorry, we are not right now we are not discussing about that. But then Prerna, we
Yes.
can get back to you later with that question.
And how to know if the mother is producing enough milk is one more question.
Yeah, okay. See, a mother's milk production cannot be measured in any amount as of now. Okay. A healthy baby, a good weight gain, if the baby is passing 4 to 5 times urine, is pooping well, then that indicates that the baby is getting good amount of breast milk.
Okay. There's one more question. I think after this we'll take the last question, I think. What do you say, Nilüfer? Yeah.
Yeah,
Yeah.
we are actually
How
getting a lot of
yeah,
questions. There are few questions which we have.
One second, just sorry to interrupt. Someone is asking, is this a serious issue?
I
I
didn't
think
get
it's a,
what the issue is. Yeah,
yeah.
I saw that,
It's about
but
the grayish stool. It's the same person.
no,
no, no, no,
No?
no, no.
I know, I don't know because the questions don't stay with the the
Yeah,
more
that's what.
you start joining, questions keep moving up. So no.
Yeah.
Yeah, if they could,
Okay.
ask, if you could
Ask again.
type, yeah, ask again which issue you want to know about, then it will be
Yes.
great.
Yeah, please.
There's one
And
more
yeah,
question. How,
even
yeah,
if
after the,
the video has ended, I just want to tell it to that person who asked whether it is a serious issue. You can always ping us or you can ping Dr. Deepa directly.
yeah,
Yeah, whatever you.
yeah, and how to know it's time to feed or anything relatable?
Feed the baby.
Feed the baby.
Yeah, usually we advise initial few days of life, every 2 to 3 hourly, you wake the baby up and give feed. That is the ideal. 2 to 3 hourly we would initially recommend. Yes.
Okay. Nilüfer,
If
you want
that
to
was
ask?
what she meant.
There are so many
Yeah.
questions. Actually,
You can ask from the one story, from the story
yeah,
which we listened.
I'll do that. Just I want to address to all the people whose questions we have not been able to answer because maybe we have missed it in the in the long loop of questions.
Yes.
If y'all can please post us your questions, y'all can send us a direct message either to new mother or to Dr. Deepa, and we should be able to answer your questions. Okay. Before moving on to the stories question, I'm just taking up this last one. Baby
Mm-hmm.
poops 3 to 4 times a day, and it is mustard color and somewhat curdy texture. Is it normal?
Yeah, it's okay. It's fine.
It's fine. Okay, I'm just moving on to the stories. Okay, the stories questions have mostly been answered. Okay, there were like around 40 questions in the stories, but
Okay.
then we have answered almost all of them during the discussion itself. Few I had separated out because they were not really relevant to our topic. Okay, it's mainly regarding the sleeping position of the baby. Is sleeping right side affecting the baby's head? Whether flat head of baby goes away eventually, or we have to take any measures to treat it.
Okay. See, baby's position of the head, right? It and position and shape of it changes. When a baby is delivered, it's soft. This whole thing, the bone is soft in consistency. So there will be slight changes in baby's position, and also it depends upon how the baby's head was in the mother's womb. Okay, if the baby was continuously towards one side, so this side would be flat and this side would be slight bulgy, but eventually as their growth and development takes place, this change in the head shapes and all, they go back to normal, so there is nothing to worry. And regarding sleeping position, yeah, any if the baby is sleeping on the left side or the right side, it's okay. Usually they do it because that's how they are in the womb, so suddenly you can't expect them to sleep straight and all tight. So yeah, if the baby is comfortable with that, then no problem, you can go ahead.
Okay. Yeah. So I'll just in the last question, Vidya, you can go ahead with the last question. Um, just one thing before that, there were many people who asked, they are pregnant and they asked about any kind of advice from you, which whatever things you would suggest them that
Hmm.
they need to do, just general advice to new
Okay.
mothers after,
Okay.
they had the baby.
Okay. So I would just tell them, enjoy this phase, stay calm, and stay relaxed. Okay. So everything will go on smoothly. Don't panic. And most of the mothers would be able to feed their babies. Okay. But in case if you are not able to feed for the initial few days because of your own health or any other reason, don't panic for that also. Just stay calm. Okay, and keep a watch on the baby on, and whenever you feel anything is not right about the baby, then rather than experimenting at home, please consult your doctor immediately. That I would personally advise, because that usually happens in many homes that I come across. So I personally tell them, whatever you want to try on your baby, first you try out on yourself, then you can go ahead and try it on the baby. Other than that, just stay calm, relaxed, and go through it smoothly.
Thank you. There's
Okay.
one more question here, Nilufar. Dr. Deepa, should I read it?
Yeah, yeah, no problem.
Yeah, after this, yeah, one more. Hi, my baby is 1 year now. She's got 4 teeth up and down, and she's biting me hard, although I have a very good milk flow. Maybe she wants
Yeah,
to know what.
this happens, this while teething, they tend to bite on the nipple. It doesn't relate with your milk flow or anything. It's just because of the teething she does that. And yeah, if it is causing pain to you and she is 1 year old, baby is 1 year old, then you can just tell her not to do it. She'll eventually understand it. But there is nothing you can do because of the biting thing. Kids tend to do it.
Yeah.
Okay.
Yeah, there was one more question asking whether the baby is less than 1 month, and whether they can use diapers. So I think yes,
Yeah,
right.
you
Yeah.
can use it. It all depends. Yeah, you can use, I guess.
Just try to keep an eye on, the baby is not having any rashes or something.
Yes,
Better to
yes,
take
yes.
preventive action than taking
Yeah,
action after the rashes have happened, because that's
yeah, yeah. That is very painful for the baby. Yeah,
painful for the mothers and fathers as well.
yeah, 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 yeah. Definitely.
Yeah, I think, yeah, that's the end of the questions as far as I can see. Vidya,
Yeah.
you asked something?
Yeah, the last one is, could you please share some pointers regarding, when should the new parents reach the doctor, pediatrician immediately for the newborn?
Okay. Okay. See, once you have baby at your home, make sure your baby is feeding well. If the baby is not taking feeds well, if baby is very lethargic, is not passing urine frequently, is extremely yellow to look at. Okay, is if there is bleeding from any site, and if there is any infection like any eye discharge, any pimple like thing on the body, anything like that, if the baby is becoming blue, especially the lips, hands, legs, something like that, then you can immediately go to your doctor.
Okay.
This again doesn't happen on a regular basis. This is just some of the things, warning things you will have to watch for. Other than that, then there is nothing to worry. If the baby is feeding well, sleeping well, pooping, then nothing to do.
Yeah, thank you for Dr. Deepa. There are two more questions. It looks like people
Yes.
are really worried. If you can answer this, and
Yeah, yeah.
guys, yeah, we have we have exceeded the time limit that we had for the
No,
session.
no problem. Yeah.
So, yeah, just these two questions. And after this, if you have any questions, please send us a message and we will get it to Dr. Deepa. My baby is 1.5 years and he is getting molars. He's teething basically, his
Okay.
molars are
Yeah.
coming out. He's passing liquid stools and he has lost his appetite. Is it normal?
Okay, so this is a very interesting thing. Teething is correlated with having loose stools and all. Okay, but it is not actually because of teething. It's because that during teething, kids tend to pick up whatever they get in their hands and put it in their mouth. That causes infection. Okay, so if it is really foul smelling, liquidy stools, and your baby is not having an appetite, it might be due to teething. But I would personally suggest you kindly consult your pediatrician for that and make sure he's not having any ongoing stomach infection or anything.
Yeah, that is actually the best thing to do. Don't ignore that. My
Yes.
2-year-old boy does not go to sleep before 12:30. Yeah,
Okay.
he wants to know.
Having a healthy sleep habit is again a thing. Make sure all the lights are off, and make sure there is no screen time at least 2 to 3 hours before going to bed. Make sure you give a good amount of a glass of milk before sleep, because milk again contains some amino acids which help in regulation of the sleep. And if the baby is waking up late in the morning, shift that slowly to a little earlier time so that night time baby is able to sleep early.
Yeah, it's mainly like, changing your habits also along with your baby's habits.
Yes.
Because unless and until
Yes.
we do that, they will not change their habits. I have that experience with my baby. I can say from my experience that no, babies are like, they're very stubborn. They want you to
Yes.
change. You first change, then only
Yes.
they will change. So
Yeah.
if you want a
They
baby
they
to
learn from what you do, right? Whatever you
exactly,
do, they'll do.
yeah,
Otherwise, they won't.
yeah. And especially 2-year-olds, yeah.
Yeah, yeah, definitely.
Okay, thank you so
Okay.
much, Dr.
Yeah.
Deepa. Thank you so
Thank
Yes,
much
you.
for
thank you so much.
Thank you,
for
guys. Thank you.
taking
It
Thank
the
was
you.
very
time
nice and
to questions.
refreshing.
It was awesome having you with us.
Yes. Yeah.
Yeah.
Okay. Take
And
care. Bye
thank you
bye.
everyone for
Thank you.
joining us.
Yeah.
Yeah.
Thank
Bye.
you.
Thank you.
Bye.
Bye.